Hi, I'm Anna Runkle, and for many years I've worked with staff and providers in healthcare settings to make changes that result in a more positive patient experience. Patient experience is a buzzword in healthcare these days. Delivering a great experience, we now know, is not just about patient satisfaction. It can strongly influence health outcomes and make the difference between a stressful workday and a day that's filled with purpose, teamwork, and the joy of making a real difference in people's lives. Patient experience can also dramatically impact the overall success of your agency. More than ever, healthcare systems are focusing on quality, and it's important that we do our best to exceed patients' expectations throughout the visit. In this video, we're going to look at 5 simple skills that can help you quickly improve your interactions with patients. Let's look at what they are. 1. Make a welcoming statement. 2. Use friendly words and tone of voice. 3. Demonstrate empathy. 4. Put things in the positive. And 5. Offer options. We'll show you some common ways things can go wrong in a patient interaction at the front desk, in the back office, and in the exam room. And then we'll see how these 5 skills can turn it all around.
No, we can't do that. Like I said, we can't do that.
This is Margot, and she floats from the front desk to the phones to the exam room. Like a lot of clinic staff, she's dedicated to delivering great care to patients, but she does a lot of multitasking, and that means she's often in a hurry with patients. Let's watch how she handles it when a patient drops in and wants to be seen.
Can I help you?
Yes, I think I need to be seen. I was here a couple weeks ago and I had an infection. I think it's back.
Do you have an appointment?
No, when I was here last, they told me to just drop in if my symptoms came back.
Let's see. He might have something at 5. He told you to just drop by?
He said to call or drop in. I was on antibiotics, but they weren't working, or they were at first, but...
Yeah, it's just that we don't really have anything today. What's going on? Is it a UTI or something?
Yeah, I think it's back. It's pretty bad.
Okay, well, we'll probably need to get you in today, but I mean, you're going to be waiting for at least an hour, and I can't really guarantee when he'll be able to see you.
Okay.
Yeah. So what's your name?
Sally Pearson.
Okay. I'll get your chart. You can take a seat, and I'll let you know what he says.
Thank you.
Okay, so how was that compared to the front desk where you work? Margot maybe didn't demonstrate the best front desk skills you've ever seen, but her words and actions were not all that unusual. But let's look at it from another angle, from the point of view of the patient. For Sally, this encounter actually made her feel, what, bad? I mean, here the doctor told her to just come by if symptoms came back, and they did, so she came back, and now Margot's barely hiding that she finds Sally to be a real pain. Have you ever been made to feel this way? I'm going to bet you have, because in any workplace where there is not an explicit focus on the patient experience, policies and behaviors will tend to creep towards what is convenient for staff. It doesn't mean we're bad people. It's just human nature. So we need to consciously focus on the patient experience. So how do you do that? There are millions of ways we can improve something in our lives. What I would like to share with you are 5 simple skills you can use that will radically improve the patient experience. They aren't cookie-cutter answers to everything that can arise. Rather, they're guidelines you can use in any situation that will help you improvise a response that makes a difference. Okay, so let's go over the 5 skills again. They are: 1. Make a welcoming statement. 2. Use friendly words and tone of voice. 3. Demonstrate empathy. 4. Put things in the positive. And 5. Offer options. So let's review Margot's patient interaction and see how we might apply the 5 skills.
No, we can't do that. Yeah, I really have no idea. You'd have to call them. Okay, you're welcome. Can I help you?
Okay, skill 1, make a welcoming statement. Can I help you is not welcoming enough. Because first of all, everybody, and I mean everybody, deserves to be greeted when they walk into your office. You may be busy with another patient, you may be in the middle of something, but these wonderful patients who come to your practice make your life and your livelihood possible. And we need to keep in mind that it's not always comfortable to come to a medical appointment. Remember, you work here. You go through these motions and ask patients these questions all the time. But patients may not be feeling well. They may feel embarrassed or defensive. And here they have to walk up and tell a stranger, often in front of a room full of strangers, why they're here. Do you like doing that? I don't like doing that. So how do we make a welcoming statement? You say something like this: "Hi, welcome, I'm glad you're here." Or, "You've come to the right place." Or, "I can definitely help you with that."
Yes, I think I need to be seen. I was here a couple weeks ago and I had an infection. I think it's back.
Do you have an appointment?
Eek. This is so unfriendly. Remember that patients often feel vulnerable and may be sensitive if they feel you're irritated, impatient, or judgmental. This is why the second of the 5 skills is to use friendly words and tone of voice. Phrases like, "I'd be happy to tell you about that," or "Good for you," or "Let's see if we can find a time that works for you."
No, when I was here last, they told me to just drop in if my symptoms came back.
Let's see. He might have something at 5. He told you to just drop by?
Ouch. Margot didn't seem to hear what Sally's saying. Sally is actually quite sick and may even be in pain. In healthcare, most situations demand empathy, and that means responding with understanding when the patient says she's experiencing something difficult: pain, infection, relationship problems, worries about an illness. And that's why our third skill for a better patient experience is to demonstrate empathy, saying things like, "I'm sorry to hear that. I hope you feel better," or "That must have been tough."
He said to call or drop in. I was on antibiotics, but they weren't working, or they were at first, but...
Yeah, it's just that we don't really have anything today. What's going on? Is it a UTI or something?
Margot may talk about infections all the time, but she's making assumptions, and for the patient, this is not something to discuss in the waiting room.
Yeah, I think it's back. It's pretty bad.
Okay, well, we'll probably need to get you in today, but I mean, you're going to be waiting for at least an hour, and I can't really guarantee when he'll be able to see you.
Okay.
Yeah.
Oh, so negative. We don't have anything. You're going to be waiting at least an hour, or I can't guarantee he can see you. And remember, the patient has done nothing wrong. She's just doing what the doctor told her to do. That's why it's important to put things in the positive. Even when you have to explain something that's unhappy or inconvenient, there's a way to make it positive. You can say things like, "There are no more appointments available that day, but what we can offer you is," or "We don't have that treatment available here, but we do have..."
So what's your name?
Sally Pearson.
Okay, I'll get your chart. You can take a seat, and I'll let you know what he says.
Thank you.
How do you feel when you have no choice? Depressed? Resigned? Angry? The sense of being stuck, having no choice, is actually the #1 cause of a rage reaction in a customer or patient situation. Having options is a basic human need. And it's also reality. If you can't give your patients some choices about their health care, then they might just exercise their choice to go somewhere else. So the 5th skill for delivering a better patient experience is to offer options. Even when you have an absolute rule, you want to avoid saying you have to fill in the blank. Instead, you can say, "For patients who want this, we ask that this." Or, "I can tell you about the procedure, the cost, and the medication available. What would you like to hear first?" Or, "What time of day is best for you?" Okay, so those are the 5 skills. Now, you want to see how that scene plays out when you use the 5 skills? Let's watch.
Hi, welcome. I need to finish this phone call, but I'll be right with you, okay?
Right away, she set a friendly tone with friendly words and tone of voice.
All right. Thank you for waiting. I needed to finish the phone call, but I didn't want to just leave you standing there. How can I help you?
That is what we call a welcoming statement. Very nice that she had that window closed so she could keep her phone conversation private too.
Yes, so I think I need to be seen. I had an infection. I think it's back.
Do you have an appointment?
No, when I was here last, they told me to just drop in if my symptoms came back.
Okay, and he said to just drop by?
Okay, she was surprised, but she stayed friendly.
He said to call or drop in. I was on antibiotics, but they weren't working, or they were at first, but...
Okay, I can tell that you're uncomfortable.
She demonstrated empathy, and again, she was friendly.
Fortunately, things should open up soon. So if you want, you can wait. Although I think it could be, let's see, as long as an hour because we have 4 patients who've been taken back already. But I'll tell you what, if you want to go out and come back in an hour, I can hold your spot for you and we should be able to get you in pretty quickly. Would you rather do that?
No, it's okay. I'll wait here.
Okay, you'd like to wait? All right.
There it is, options. Here, instead of telling the patient she has to wait, she's offering options. She can wait an hour or come back in an hour. It's still an hour, but it's a choice.
Write your name on this for me, please, and I'll get your chart. We'll call you back just as soon as we can, okay?
Thank you.
Yeah, sure thing.
And there it is, the 5 skills to improve the patient experience. We hope this video has inspired you to put the 5 skills into practice. They're simple, they're powerful, and they can make your work life more meaningful and happy. Positive interaction is just one part of providing a great patient experience, but it's an important one. Keeping these 5 simple skills in mind can help you maintain a focus on making every patient experience a great one.